Anyway, so Tricia Thompson is the dean of the Grand Valley State University Nursing School. And recently, the school received a big federal grant to improve nursing workforce readiness through simulation. Clearly, this caught my eye since we do technology. So, welcome, Tricia.
Nice to meet you, Mike. Thanks for having us.
So let's talk about this. Fill in the gaps of what I just said. That was the real Cliff's Notes version. So talk a little bit more in detail about what this money is. You got it from the feds, and it's going to be used for the simulation process. But beyond that, I'm not real clear.
So let me just identify a couple things, Mike. Right, my name is Tricia Thomas, and I am the dean in the College of Nursing. But our simulation center is actually an interprofessional simulation center housed within our college in terms of operational reporting, but actually utilized by disciplines, nursing, all of our allied health disciplines, engineering, computing science, and social work. It's about 68,000 square feet, and I've got my colleagues here who can really address and answer those important simulation questions. But to your point, the Simulation Center actually applied for this grant, and I'm delighted to have my colleagues with me who are the experts in simulation and clinical practice. We really were trying to address several pressing needs in the nursing industry. So I think it's well known that there's a tremendous workforce shortage of nurses across the Michigan and across the country, in fact. And one of the things that we've identified, both with our colleagues in practice, but equally with our students, is that many of them choose to leave the profession about 18 months after graduation, in large part because of a perceived lack of readiness to do the contemporary practice that's required in today's workforce environment. So we've been very fortunate at Grand Valley to have exceptional partnerships with large health systems in West Michigan. We've been equally fortunate to have significant support, both from the university and from our surrounding community, to build an impressive state-of-the-art simulation center that can be used by all of these health disciplines to help prepare our students. And when I say prepare our students, what I mean is the gift in a simulation center is students come together to learn. They actually use simulation to enact clinical decision-making and clinical judgment in a lab setting. I'm going to have my colleagues talk about the fidelity in the mannequins because they are much more adept than I am. But it also allows us to have students actually enact nursing practice and observe nursing practice so that when they leave the simulation, they can walk through a debriefing exercise and learn both by what they did, but also by watching their classmates and colleagues as a faculty guides them through a conversation and learning. So we are very fortunate here in West Michigan to have this amazing center. And what our practice partners were telling us loud and clear for about the last decade or so, actually, Mike, is that we have very capable and bright, talented nurses that graduate both from our undergraduate and our graduate programs, and they struggle to be able to keep up with the demands of contemporary practice. And one of the things that we recognized is that our students, while very capable in managing one patient or one clinical situation, when we begin to add complexity to that in what would replicate a very dynamic clinical environment, it is more difficult for them. Likewise, they're not able to learn together and with one another and to debrief. So when we put students in simulation, we want them to learn how to engage in practice, high risk, low volume clinical situations, but also to recognize the support team around them, including medical assistants and other interprofessional team members. This HRSA Workforce Diversity Grant, which is what we're really talking about, actually affords us $1.5 million over the next 3 years to create multiple patient simulations that allow students to actually have clinical experiences with 3 different patients all at the same time, much as they would if they were in clinical practice. I'm going to talk a little bit about the workforce element in this. What we recognized is We have a lot of shortcomings in clinical practice, in large part because of policies that have been in place for many years that actually discourage people from underrepresented groups and or restrict those individuals from being considered for nursing school. So two of the things we want to do is really talk about student and workforce diversity and really begin to identify ways in which we're able to encourage them to engage with us in simulation and education, but also to prepare those who may work or live in underserved areas throughout Michigan to learn with us so that they can go back and practice in their home communities. So there are many things that we're hoping to accomplish with this work. I really do want to pause and allow you to meet my colleagues who are experts, both clinically with simulation, but equally with the technology that's going to be used, Mike, which is what I really think you're aiming to look at. I just want to say thank you for giving us the opportunity to share this with you and your audience as we go forward.
All right.
So yeah,
Matt?
let's have the folks that I'm seeing here elsewhere on the screen go one at a time and introduce yourselves. How about my namesake here, Matthew? We'll start with you.
Matt Culver, work as our operations manager here in the simulation center.
And Douglas?
Yep, my name is Douglas Sayers. I work here as the simulation technology manager. Happy to answer any questions related to that, clinically wise.
Okay, and last but not least.
I'm Kelly Clark, one of the multimedia managers here in the Sim Center.
Okay. So I was curious. I mean, healthcare has used mannequins for a long time. Even when I was a kid, there was good old Resusci Annie teaching you how to do CPR, right? So talk a little bit about the increased sophistication of the electronics and of the technology in some of these mannequins.
Yeah, I'm happy to take that. So mannequins, like you've said, they've been around for a long time. However, the fidelity or the lifelike of these mannequins has only grown. Today, we were using mannequins today to represent a postpartum bleed or postpartum hemorrhage after a birth of a child. So students had to manage and recognize that this mannequin's vital signs were decreasing as she was having blood loss. So just being able to get a blood pressure change on these mannequins like a real person, being able to feel strong pulses go from bounding to weaker and weaker and weaker. These kind of things, these adaptions that are happening, very high tech. It takes an operator, it takes someone to program these things, making sure all the connection is right from a control room into that simulation room and giving the students all the correct information because we want them to succeed. We want them to have this opportunity to grow and to learn. And it enriches that debrief so much more when everything works. So that's technology has blown up and students really appreciate it.
So go ahead, Matt.
Mike. No, you go ahead, Mike. It's your turn.
Okay. Yeah, we alternate. So getting back to the simulation now, obviously it'll be really great for the nursing school at Grand Valley State University. Now, are you going to be sharing those simulations with other hospitals, nursing schools around the state, or how does that all play out?
So faculty will have the development of these clinical scenarios that will all run concurrently. So 6 sets of scenarios will be developed, 3 running concurrently in 6 rooms. Part of the responsibility of the HRSA grant is to obviously bring in colleagues. So our partners will help us develop the scenarios so that they are realistic and represent what is credible in clinical practice. And likewise, as we move through the grant period, we will share information that we've learned about the success of our students, their ability in competence building, our ability to replicate through the data that we're collecting. And then at the end of the time period, part of what we're going to be asked to do is to share our findings and to disseminate what we've grown. So there is some expectation, right, and obligation that when you receive federal funding, that in addition to sharing your results, you also share your findings. There are 23 other sites across the United States, a blend of both academic settings as well as clinical practice settings that have earned an award through HRSA for this grant. So they too will be sharing their experiences And then I think everyone can benefit from this.
The one at Grand Valley, though, sounds really impressive. Large, 68,000 square feet. That number jumped out at me. So how is it laid out?
Go for it, Matt.
Yeah, so we have a simulated hospital suite. It's an 11-room hospital, and each room is outfitted with equipment that you'd find in a hospital room. It's all working diagnostic equipment, the bed, even operating the bed. It would be something that we could practice in here than those types of beds you'd find in the clinical setting. They're also outfitted with cameras, speakers, and microphones. So everything that takes place in, let's say, our hospital room can be facilitated, operated, and monitored remotely. So students, after they go through a pre-brief, understand objectives and goals for the day, they're going to walk in to the room inpatient as a nurse, greet their standardized patient or their mannequin patient, go through their steps and really develop a patient care plan and administer that patient care plan. Everything behind the scenes is taking place so faculty can view what's going on in the room. They can communicate with the operator of the mannequin to prompt or to proceed through the scenario. And then our operators, they can hear, see, and communicate into the room. So we use standardized technical communicators is what we call them, but they are going to operate and voice for the mannequin. So they essentially will act as the patient in addition to operating them. That's a typical space. We have assessment labs, 11 assessment labs, and we also have a 24-room outpatient exam area. It's essentially a 24-room doctor's office. So we can be versatile as far as what we do in those rooms, but typically we would bring in a standardized patient or a community member that's been trained to either portray themselves or a case.
Matt?
Okay. So Kelly, tell me a little bit about, what your role is at the Simulation Center.
What I do is I make sure that everything that both Matt, Doug, and Trish talked about, make sure it all works in harmony. So getting everything patched between the exam room or the hospital suite into where our standardized technical communicators and faculty are and students who are observing, make sure all that background information is all set. We control all of the audio visual, so any of the cameras, the mics, the speakers, we would take care of that. A lot of the programming that we do with either the mannequins, we assist with that as needed. And then there are other technology in the Sim Center that we work to enhance our simulations and scenarios. Just a lot of the background tech stuff that we don't see, but we know is there.
And I noticed also in the materials you sent us, you have Corewell Health as one of your clinical partners. That's formerly known as Spectrum, I believe. But you also have Pine Rest, which is a mental health facility. So talk a little bit about how this sort of simulation works in a mental health setting.
I think like any clinical situation, Matt, right, we are able to use mannequins and program them to respond as we would anticipate a patient or a community member would respond. So part of what we're hoping to do as we walk into this multiple patient simulation, as we focus on psych behavioral mental health, is the reality, right, that all of us interface with people who have mental illness, both acute illness, but also chronic illness. And our ability to make the patient experience as realistic as is possible is really going to be aided by our partners helping us to appreciate what they're experiencing in their own practice settings so that we can replicate it through the mannequins and through the experience the students are having. So it's both acute and chronic illness in behavioral mental health. Many people across the country, as you well know, are facing mental health concerns, both those of great magnitude and those that we manage daily that others wouldn't even recognize us as having that chronic illness. So what we're hoping our practice partners are able to do is to bring sort of a realistic experience into these simulation suites with our students and to help us to develop the scenarios so that students can experience it first in the lab, while they're in school with people around them, but also learn how to be the most effective care provider they're able to be. So both Corewell and Pine Rest are our partners. We have some amazing academy and scholarship programs with both of those organizations, as we do with Trinity Health and McLaren, and they've really been very committed to helping us learn how to help students feel more confident and be more prepared for their practice. And they're very willing to step in and help us with that. They actually benefit when we're able to support our students in that way, because when they come into the workforce, they feel more prepared, more confident, more able, and they are less likely to leave in that first 18 months. So I'm very grateful, honestly, and thank you for asking that, Matt.
Well,
Okay.
we're coming down to the end here. Any final questions that you want to throw out there, Matt?
No, I think we're good. If people want more information about all this and about the opportunities that you have there at the Simulation Center, is there a particular part of the GVSU website that they should go to?
I'm going to say we actually have an amazing website for the Interprofessional Sim Center, and that would be the place to start. If they have any questions, Matt, why don't you go ahead and give them your email address, and then you can get it to the right individual for us.
Yeah, we'll do our website. Kelly maintains that. It's gvsu.edu/sim center. And you can share my contact information as well if you'd like.
Sure,
Please.
absolutely.
Yeah, email is going to be my last name, Culver, COLLV as in Victor, ER, first initial M as in Matt, @gvsu.edu.